Hey everyone, I'm Dr. Shahid and we got a brand new video series here on Operative Dentistry, and we're going to kick things off with dental caries. We'll discuss how it forms, how to classify it, and how to manage it, focusing on high-yield concepts that are essential for both the exam and clinical practice. Let's start by explaining how caries actually forms, and to help us do that, we have a patient here who's about to indulge in a good old can of Coke. Now, Coke has a lot of sugar, and whenever you eat or drink something, you're going to have remnants remain on the teeth. But truth be told, the sugar isn't actually what forms caries. The main culprit are actually the bacteria that metabolize the sugars and produce acid byproducts. The main one you're going to want to know is Streptococcus mutans. These acid byproducts, assisted by the acidic drink, can lower the pH of the mouth, and the magic number here is 5.5. This is known as the critical pH, below which we'll have hydroxyapatite crystals in the enamel dissolving, releasing calcium and phosphate ions into the oral cavity. This whole process is known as demineralization, and if it continues to occur, it marks the beginning of a cavity, or dental caries as we like to call it. Now, remineralization is the body's natural way of repairing this damage, and saliva plays a huge role here. Saliva constantly buffers acidity in the oral cavity. It's a 24-hour process. And it's also rich in calcium and phosphate, which can redeposit into the enamel structure. This remineralization process can be further enhanced with the application of fluoride. When we paint fluoride varnish on a tooth, we essentially encourage fluoride ions to interact with the calcium and phosphate ions in the enamel matrix to form fluoroapatite, which is more resistant to acid attacks than hydroxyapatite. This formation of fluoroapatite decreases the solubility of calcium phosphate, which resists demineralization. So all in all, the balance between these two processes, demineralization and remineralization, determines whether enamel stays healthy or develops a lesion. This is why preventative treatments like fluoride application and maintaining a neutral pH are so important in caries management. Alright, now let's talk about caries progression. First, we'll discuss secondary dentin. Secondary dentin is a layer of dentin that's formed after the root of a tooth has been fully formed. It's deposited throughout the lifetime of a tooth. Now, it's important to note that secondary dentin is not associated with pathology and is not a result of dental caries. On the other hand, as a carious lesion advances into dentin, the tooth may lay down tertiary dentin. This is a defensive response by the pulp to protect itself. Tertiary dentin isn't typically well organized, but it serves as a barrier against the advancing decay. Now, unlike secondary dentin, tertiary dentin is formed as a result of caries. Another effect of dental caries is the formation of dead tracts, which are the empty dentinal tubules caused by the death of odontoblasts. These tracts act as a pathway for bacteria to penetrate deeper into the tooth, increasing the risk of pulp infection. And just like tertiary dentin, dead tracts are a result of dental caries. The best way to avoid these issues, guys, is with proper preventative measures and correct management strategies, which segues really nicely into us quickly discussing CAMBRA. CAMBRA is an acronym that stands for Caries Management by Risk Assessment, and it represents a modern, evidence-based approach to understanding and managing dental caries. Unlike traditional methods that focus solely on treating decay once it's present, CAMBRA emphasizes the identification of risk factors, such as a patient's medical and dental history, along with other risk factors. Behavioral approaches are then used, as well as chemical treatments like fluoride and chlorhexidine, to address the risk factors. This dual assessment helps us determine whether a patient's oral environment is more likely to favor demineralization or remineralization, as we discussed earlier. The ultimate goal of CAMBRA, guys, is to prevent caries from starting, rather than dealing with it once it's been established. Now, you may be wondering, what risk factors are considered in CAMBRA? So I'll go over a few that you should be aware of, starting with poor oral hygiene. This is the main one you gotta watch out for, since irregular brushing and flossing allow plaque to accumulate on teeth. Next, we have xerostomia, which is an especially important risk factor for root caries since cementum is nowhere near as strong as enamel. Then we have diet and nutrition. Sugary snacks and beverages are fuel to bacteria like S. mutans, accelerating the caries process. Socioeconomic status also plays a role, since individuals from lower income backgrounds often have limited access to dental care and education about oral health. Certain risk factors are specific to children. For one, children with siblings who have a history of tooth decay are at a higher risk since they often share the same environment and dietary habits. Additionally, bottle feeding before bedtime is another obvious risk factor for early childhood caries. Lastly, it's important to note that allergies are not considered a direct risk factor for dental caries. Something to remember. Alright guys, last thing we're going to talk about is the ADA Caries Classification, which everyone should know about. Let's go through each classification step by step. First, we have the E0 classification, which represents no lesion at all. Then, we have E1 lesions, which are confined to the outer half of the enamel, and that's what the E stands for, enamel. On a radiograph, these appear as radiolucencies that do not extend to the DEJ. So at this stage, the lesion is still in its early stages, and it can be reversed with remineralization strategies such as fluoride application and improvements in oral hygiene. Next are the E2 lesions, which extend into the inner half of the enamel but still haven't crossed into dentin. So these lesions are more distinct on radiographs since the radiolucency is closer to the DEJ. Now, like E1 lesions, they're still potentially reversible if caught early and managed with appropriate preventative measures. Once the lesion crosses into dentin, the naming changes to D1, which refers to caries that extends into the outer third of the dentin. At this stage, bacteria have penetrated the enamel barrier, and the softer nature of dentin allows the lesion to progress more quickly. So when we're at this point, remineralization can still help slow the process, but restorative treatment is going to be necessary to prevent further damage. Now, as the lesion progresses into the middle third of the dentin, we call it a D2 lesion. Radiographically, these lesions appear as larger radiolucencies beneath the enamel, indicating significant decay. And at this point, remineralization is no longer sufficient, and restorative intervention is critical to preserve the tooth and prevent complications. Finally, we have D3 lesions, which are the most advanced. These extend to the inner third of the dentin and often approach or even involve the pulp. At this stage, the damage is extensive, and the risk of pulpitis or infection is high. These lesions typically require more complex restorative procedures such as indirect restorations or even endodontic therapy to address the decay and protect the tooth. So all in all guys, this classification system is invaluable because it allows us to precisely assess the extent of decay, decide whether remineralization is still an option, and determine the most appropriate treatment plan. Alright, and now it's time to reinforce everything we just learned with some practice problems. So question 1 reads, each of the following is a result of dental caries except one. Which one is the exception? Pause the video if you need some time to get your answer. But the answer is A, secondary dentin. Remember guys, secondary dentin is a natural byproduct of normal aging, and it isn't directly related to caries, whereas the other option choices are all associated with dental caries. Alright, question number 2. What is the classification of the carious lesion present on the mesial surface of tooth number 14? Again, pause the video if you need some time, but the answer is D, D3. Looking at the mesial surface of tooth number 14, we can see that the carious lesion is not only well past the DEJ, but it looks like it's at the level of the pulp horn. So this decay is extensive, and so we'll want to pick the most severe stage in the classification, which is D3. Okay, here's our final example for today. Which bacterial species is most commonly associated with dental caries? This should be an easy one. Pause the video if you need, but the answer is S. mutans. This one's a straight memorization, guys. You have to remember that the main culprit in dental caries is S. mutans. And with that, we are done. As always, here's a list of high-yield summary points to keep in mind. Thanks for watching, guys, and see you next time.